Happy New Year's, Desert Highlands. Hope everybody had a great holiday with their family and friends. Over the past week in the news, obviously we've had some pretty tragic happenings with regards to health and safety, and we thought it'd be a great opportunity to discuss with our members some of our health and safety protocols around property and show you a little bit more about what you have at your disposal.
Hello everyone, Nick Solanto, Director of Security. Just wanted to make you aware of the things that we do as far as security here at Desert Highlands, taking care of the members. One of the things to start off with is, in the event of an emergency, what we would like to have you as members do is call 911 first. We want to get the paramedics, Scottsdale Fire Department loaded up and on the way. And then if you have time, call us second. We're here on property already. My staff is first aid, CPR, AED trained through the Red Cross. I do the instructing for that, and then we can get to the house and assess the situation and stabilize the person who was injured prior to the paramedics arriving on the scene. With this video today, what we're going to do is take a tour around property, show you the different life-saving devices that we have here on property, and also attach a video to show you how to do CPR, and we'll show you how the AEDs work here on property, so in the event something happens, you'll be able to help yourself or help the person that's injured. Okay, we're over at the fitness center now. I'm with Kelly, the fitness director. We're going to take a walk around her area and show you the different devices that we have here as far as AEDs, emergency devices. So let's take a walk inside and we'll see what we have.
Let's go. Hi, Desert Highlands, Kelly at your fitness center. Want to make sure you guys know where all the safety tools are here for you. So right behind Nick and I is our defibrillator, AED. It's right by the reformer and by the back door here at the fitness center. When you open this door, you're going to hear a very loud alarm, and then you'll be able to take this box out, and Nick will have a demonstration on how to use that box a little later for you, but here's where this is located. All right, members, as you can see, we're up here by our front desk by the headphones. There is this emergency pull button. So in case of an emergency, you stick your finger in the top, pull down. What that does is notify ADT, which will then in turn notify security. Okay, and next, over here by our coffee station and our board, we have this big red phone here. You don't need to dial, you pick it up, it'll go straight over to security and they'll be on their way up here with help. Okay, next we are in the women's locker room near the showers and the steam room. As you can see, there's a big red sign here, and I'm going to take you inside the steam room to show you where that pull button is. Here we are in the steam room. As you can see, the button is right here by the door. It's the same button that we saw in the front of the fitness center. Finger goes in, you pull down, and there's one identical in the men's steam room. So if you're in here by yourself, you feel shortness of breath, chest pain, you feel like you need help, the button is right here and we'll be on our way.
In addition to the emergency devices that are in the fitness center, we have a number of additional AEDs throughout the property. At the Racket Club, there is an AED and an emergency phone, similar to the phone in fitness, which dials directly to security, which is located in the hallway by the bathrooms. There are also AEDs located on the golf course in the men's comfort stations between holes 6 and 7 and 14 and 15, and in the men's room at the putting course. Also, there are a number of AEDs around property for staff usage, including the clubhouse, golf shop, admin, and in the security vehicles. Attached to this is a short video with instructions on performing continuous chest compressions or CPR without giving breaths. I will be sending out a note regarding a class for members that I will be teaching. If you are interested in attending, please keep your eyes open. Until then, stay safe. Okay, what I want to do now is give you a quick demonstration of the AEDs that we have here on property. This is the training model that I use for training the staff here on property, and I'll give you a quick demonstration on how it works in the event of an emergency. So these are going to be the AEDs that you'll find in the white boxes, similar to what you saw at the fitness center, tennis center, and in the bathrooms. So what you want to do is you're going to take the AED out of the container, and what you want to do is once you have it in your hands, you're going to push the green button. Once you do that, the AED is going to walk you through all the steps that you need to take. If you ever do have an emergency, this is going to be your best friend. All you have to do is follow instructions. So what I'm going to do is just hit the button. It'll walk you through a couple different scenarios so you can hear how it works. And then we'll end it right there.
Adult patient. Call for medical assistance. Remove clothing from patient's chest to expose bare skin. Pull green tab to remove pads. Peel pads from liner. Apply pads to patient's bare chest as shown in picture. Press pads firmly to patient's bare skin. Pull green tab to remove pads. Assessing heart rhythm. Do not touch the patient. Analyzing. Do not touch the patient. Stand clear of patient. Shock advised. Stand clear of patient. Shock will be delivered in 3, 2, 1. Shock delivered. Begin CPR. It is safe to touch the patient. Place overlapping hands in middle of chest. Press directly down on the chest in time with metronome. Remain calm.
Okay, that's the AED. Just a couple things again. The green tab is going to be at the bottom of the AED. That's also where the battery is located. The pads are located in that area. On each pad, it shows you where to place the pad on the person. And then once they're on the person, the AED will then assess the situation, determine whether or not it needs to shock. If so, it'll show you, it'll shock just like it just did. At the end of the shock, it'll then assess, determine whether it needs another shock or whether you need to begin compressions. The tone at the end of the compressions were the pace that you need to do the compressions, which is one compression or 100 compressions for 60 seconds. And then at the end of that, the AED will then determine whether or not another shock is necessary.